Invited media, thank you for coming. My name is Dr. Anusha Viswanathan. I am a pediatric infectious disease specialist and a parent living in the school district. I am also a community member concerned about the health of all of our children. We have heard from Dr. Mahmood highlighting the importance of following expert pediatric infectious disease and educational guidelines from the AAP, from the CDC, from the Pennsylvania Department of Education as recently as today. And you have heard Jennifer Bish quote the commissioners of Bucks County regarding the inability to accurately predict how the virus may affect communities week to week, month to month. For the health and safety of our children and our community, we must have a far better plan of action than the one put forth in the current health and safety plan from Central Bucks. We are in a pandemic of viral variants. COVID is increasing throughout the country, fueled by the Delta variant, responsible for more than 80% of COVID cases currently. Before we dismiss this as an inevitable occurrence in the fight for strain dominance, please take note that Delta's vastly higher viral load, 1,000 times higher, in fact, leads to increased transmissibility. Even vaccinated people may play a role in transmission, leading to the changes in masking and other mitigation recommendations from health authorities as recently as today. Locally, over the last 4 reported days, we have had 143 new cases in Bucks County, or an average of about 36 cases a day, which is a small increase. But given the favorable variables in midsummer, this is worth following closely because it indicates that Delta is circulating locally. Current COVID vaccines still appear to prevent severe disease, but slowing vaccine uptake, the chances are higher that new variants could press our luck. This is not fear-mongering, this is the truth.
Hold up.
Yes, support staff.
Thank you. Yeah, you work for the teachers too.
Thank you for carrying
Which brings me to my second point. We are in a pandemic of the unvaccinated, noted by the CDC and local health public officials here and really everywhere. Quote, the current surge in COVID cases around the nation is among the unvaccinated. While being vaccinated is not a guarantee against getting COVID, almost all of the COVID-related deaths and hospitalizations around the nation are among those who are not vaccinated. End quote from our Bucks County Health Commissioners yesterday. A statement by the Bucks County Health Commissioners on July 26th offered an enthusiastic endorsement of COVID vaccination in adults and children who are eligible, which currently includes those over the age of 12. However, at this moment, the unvaccinated population includes everyone under the age of 12. What about them? I have heard the refrain, quote, COVID does not affect kids so many times.
Back up. Murderers.
Okay. All right. I have heard the refrain, COVID does not affect kids so many times. And thankfully, yes, most children with COVID have an uncomplicated course. So perhaps, yes, COVID is worse for other groups. But with the contagious variant spreading, there are notable and significant exceptions to this by sheer numbers. And unfortunately, in the cold realm of statistics and quality-adjusted life years. But more fundamentally, the death and ill health of any child is catastrophic because children deserve safety I am borrowing from powerful analogy published by Doctors Nierenberg and Hoshino.
Oh,
I'm getting to that.
you can wait.
I am borrowing a powerful analogy published by Doctors Nierenberg and Hoshino. From 1999 to 2019, influenza was the 8th leading cause of death in children. But thank you to whoever in the audience said it, but cases plummeted in 2020 and 2021. As of June 2021, both the AAP and CDC estimate approximately 400 child deaths due to COVID. In about 1 year, COVID killed twice as many children as influenza does in most years, despite our efforts to prevent infection. In fact, in the 16 months since its emergence, COVID has managed to break into a sobering top 10 list causes of death in children. There has also been a legitimate discussion about hospitalizations because of COVID. In one study in a large California hospital, about 40% of kids were incidentally positive for COVID when being hospitalized for other reasons. Even accounting for that, based on CDC estimates, about 100,000 children were hospitalized because of COVID. And no, it's not only children with underlying medical conditions who can become sick with COVID, although they may be at higher risk. Multisystemic inflammatory syndrome in children, or MIS-C, a post-infectious complication of the virus, has largely occurred in children who were previously healthy and even asymptomatic at initial infection. Moreover, there is so much unknown about long COVID syndrome in kids, including precisely why it affects one child but not another. This brings me to my final point, and perhaps my most serious point, as illustrated here. We are in a pandemic of the self over others. I borrowed this phrase from an epidemiologist in Texas. A pandemic of the self over others. A safety plan should resemble layers of Swiss cheese. No one slice may be perfect, but the defense works because the layers form a barrier, mitigating risk for all, but especially those vulnerable in the committee. The current CBSD Health and Safety Plan fails to create layers of protection using the cornerstones of public health, mitigation measures, case reporting, contact tracing. In addition, local public health officials, including members in the Bucks County Health Commissioner's Office, as well as the Bucks County Department of Health, have stressed repeatedly the importance of epidemiology driving decisions. Given the clear risk to unvaccinated people, including children, daily cases reported in the county need to be looked at in a way that considers multiple variables. And yet the current health and safety plan offers no clarity regarding parameters used to trigger changes. Children and young adults have done more than what should be asked of them this year. You see examples of that resiliency all around me. But after learning about 400 deaths, 100,000 hospitalization, and inflammatory syndrome, and the still nebulous long-term effects of COVID, in addition to the myriad of psychological and social effects, how can you be so unmoved and uncaring? A verse from the Bible states, "Whatever you did for one of the least of these brothers and sisters, you did for me." All children deserve protection. All children deserve safety. Act with purpose, compassion, and clarity so that we are deserving of them. I will now introduce Pari Pasi, a Central Bucks student.